My name is Dr. Angela Ibragimov. I am one of the pediatric hospitalists. I'm also the medical director of the newborn nursery. I primarily work in the newborn nursery, the NICU, as well as the inpatient pediatric floor. The neonatal ICU is a place where we take care of our most vulnerable babies, those who are premature and requiring additional help, and then even sometimes our term babies who are sick and need support, whether it's respiratory or feeding, or sometimes infection related and need for antibiotics. So this is one of our open pods. We have 6 bed spaces here. As you can see, the nurses are in this room the whole time with their workstations and all the monitoring. The walls right next to the cribs there house a lot of our gases and ability to suction if the baby needs help with that. And then there's the medication carts as well. 6 open spaces here for our sicker babies who need eyes on them really around the clock. We have 1 more of these and an additional 12 private spaces. So we definitely have a much larger footprint for these babies in our hospital now as compared to our old hospital. The neonatal ICU is really a place of a lot of expertise, specifically during this very early and critical part of life. Having that appropriate support for babies is really critical to their well-being overall. And the services and really the ability to take care of some of the more common complications make a huge difference in the lives for these babies. This is one of our private NICU rooms. As you can see, it's quite spacious. On this side, we usually have what's known as the giraffe or the bed warmer if babies are cold and they need warming up. There's also a lot, again, suctioning and gases and all the different various ways to support babies who are having a hard time breathing. When there are families close by and who would like to room in, we do set up an additional space for them to make them comfortable and allow them to stay overnight. And then occasionally, babies who are really quite sick, they need a lot of respiratory support. So some of the machinery that comes along with that, like oscillators and ventilators, if those babies are housed here, obviously there's ample room for that now as compared to the prior hospital. Actually, one of the really cool things about our hospital is that we have a developmental team rounding on all of the newborns once a week with families usually, and that's where they review what the needs are of the baby. And although it doesn't seem like babies do very much in that beginning stage of their life, there's actually a lot that goes into all of their senses, making sure that the lighting is appropriate for their developmental stage, the positioning of the child, all of the handling and all of the cares. Because again, these are some of our tiniest preemie babies who are really quite fragile. And so we have to balance that ability to care for them and also support them developmentally. I always like to tell our families that really a big part of the medical care for your baby is having you here and having your support. We know babies do really well, much better when family is close by. They bond through smell and touch. They actually have more what's known as thermoregulation or body temperature regulation when families are nearby and doing holding and skin to skin. Depending on the condition, their family members are really pivotal part of the care to soothe and console their baby and really provide that developmental stimulation. So they're a big part of the care plan, absolutely. And then of course, the families are our patients as well. So really making sure that they are comfortable with things, that they are our eyes and ears as to what they're noticing about the baby so that we are providing the best care we can.